Chikungunya is a viral disease that has been making headlines in recent years. It can cause severe joint pain, fever, and other debilitating symptoms. The virus is spread through the bite of infected mosquitoes. These mosquitoes are found in tropical and subtropical regions around the world. As global travel and climate change continue, chikungunya is becoming a growing concern. It's crucial to understand this disease, its symptoms, and how to protect ourselves. Knowledge is our best defense against this emerging threat. By learning about chikungunya, we can take steps to stay safe and healthy. This video will provide you with essential information to help you understand and prevent this disease. Chikungunya is caused by a virus, specifically the chikungunya virus or chikva. It belongs to the alpha virus genus known for causing outbreaks of fever and rash. This virus is transmitted to humans primarily through the bite of infected Aedes mosquitoes. These mosquitoes are notorious for spreading other diseases like dengue and Zika. Once inside the human body, the chikungunya virus multiplies, leading to the onset of various symptoms. It's essential to remember that not everyone infected with the virus will develop symptoms. Understanding the nature of this virus is the first step towards effective prevention and control. Chikungunya was first identified in Tanzania in 1952. The name chikungunya originates from the Makonde language, meaning that which bends up, referring to the debilitating joint pain it causes. Since its discovery, the virus has spread rapidly across Africa, Asia, and the Indian Ocean islands. In recent decades, chikungunya outbreaks have been reported in parts of Europe and the Americas, including the Caribbean. This global spread is largely attributed to the increasing range of Aedes mosquitoes, fueled by factors like international travel and climate change. As the virus continues to spread, understanding its history and epidemiology is crucial for developing effective public health strategies. Chikungunya is primarily transmitted through the bites of infected female Aedes mosquitoes, mainly Aedes aegypti and Aedes albopictus. These mosquitoes thrive in tropical and subtropical regions, typically breeding in stagnant water sources like flower pots, discarded tires, and open containers. They are most active during daylight hours, particularly in the early morning and late afternoon. When an infected mosquito bites a human, the virus enters the bloodstream, leading to infection. While mosquito bites are the primary mode of transmission, it's important to note that chikungunya is not contagious and doesn't spread directly from person to person. Section 5. The telltale signs, identifying chikungunya symptoms. Recognizing the symptoms early can be crucial for effective management and treatment. Chikungunya infection typically presents with a range of symptoms that often mimic other mosquito-borne illnesses such as dengue and Zika virus. This can make initial diagnosis challenging. The incubation period, or the time between the mosquito bite and the onset of symptoms, is usually 3 to 7 days. During this period, the virus multiplies in the body. However, it can vary from 2 to 12 days depending on various factors such as the individual's immune system and overall health. The most common symptom of chikungunya is a high fever, often accompanied by severe joint pain. This fever can be sudden and intense, reaching up to 104 degrees Fahrenheit. This joint pain typically affects multiple joints, particularly in the hands, wrists, ankles, and feet. The pain can be so severe that it limits movement and daily activities. It can be debilitating and last for weeks or even months. In some cases, joint pain may persist for years, leading to chronic arthritis. Other symptoms of chikungunya include headache, muscle pain, fatigue, nausea, and rash. These symptoms can vary in intensity and duration, adding to the complexity of the disease. In some cases, individuals may experience mild or no symptoms at all. This asymptomatic presentation can make it difficult to track and control the spread of the virus. Fever and fatigue, common symptoms of chikungunya. Chikungunya is a viral disease transmitted to humans by infected mosquitoes. It is characterized by an abrupt onset of fever, often accompanied by joint pain. Fever is often the first noticeable symptom of chikungunya. This fever can be quite high and is usually one of the earliest signs that something is wrong. It typically presents as a high-grade fever, exceeding 102 degrees Fahrenheit or 39 degrees Celsius, and may come on suddenly. This sudden onset can be alarming and is often accompanied by chills and sweating. The fever can last for a few days to a week and may fluctuate, subsiding and then returning. This fluctuation can make it difficult to predict and manage, adding to the discomfort. Accompanying the fever is often a general feeling of malaise and fatigue. This isn't just a mild tiredness, it can be a profound sense of exhaustion. This fatigue can be intense and debilitating, making it difficult to perform everyday tasks. Simple activities like getting out of bed or walking to the kitchen can feel overwhelming. It is crucial to rest and allow the body to recover during this phase. Pushing yourself too hard can prolong the recovery process and worsen symptoms. Drinking plenty of fluids and getting adequate rest is essential for managing fever and fatigue associated with chikungunya. Staying hydrated helps to reduce fever and supports the body's immune response. In addition to rest and hydration, maintaining a comfortable environment can aid in recovery. Using a blanket or a hot water bottle can help manage chills and provide comfort. Joint pain and inflammation, a hallmark of chikungunya. Chikungunya is a viral disease transmitted to humans by infected mosquitoes. One of the most debilitating and characteristic symptoms of this disease is severe joint pain and inflammation. One of the most characteristic symptoms of chikungunya is severe joint pain, known as arthralgia. This pain can be intense and is often one of the first signs of the infection. It can start suddenly and become very severe, making it difficult for patients to move or perform daily tasks. This pain typically affects multiple joints on both sides of the body, particularly the small joints of the hands, wrists, ankles, and feet. The symmetrical nature of the pain is a key indicator of chikungunya, distinguishing it from other types of joint pain. The pain is often described as debilitating and can be accompanied by swelling, stiffness, and redness in the affected joints. These symptoms can severely impact a person's quality of life, making even simple movements excruciatingly painful. The severity of joint pain can vary greatly, with some individuals experiencing mild discomfort while others find it difficult to move or perform daily activities. In severe cases, the pain can be so intense that it immobilizes the patient, requiring medical intervention and pain management strategies. The joint pain associated with chikungunya can persist for weeks, months, or even years in some cases, leading to chronic pain and disability. This long-term pain can significantly affect a person's ability to work, engage in social activities, and maintain overall well-being. Managing this chronic pain often requires a comprehensive approach, including medication, physical therapy, and lifestyle adjustments. When symptoms raise alarm bells, seeking medical attention. While many individuals with chikungunya experience mild symptoms and recover fully, it is crucial to seek medical attention if symptoms are severe or persistent. If you experience a high fever, severe joint pain, persistent vomiting, difficulty breathing, chest pain, confusion, or seizures, it is essential to seek immediate medical care. These symptoms may indicate a more severe case of chikungunya or another medical condition requiring prompt treatment. Early diagnosis and supportive care can help manage symptoms and prevent complications. Protecting yourself and your loved ones. Essential safety tips. Protecting yourself and your loved ones from chikungunya begins with understanding how to prevent mosquito bites. Since Aedes mosquitoes are active during the day, it is essential to take precautions both indoors and outdoors. Wear long-sleeve shirts and long pants when outdoors, especially during peak mosquito activity hours. Use mosquito repellents containing DEET, picaridin, or oil of lemon eucalyptus on exposed skin. Make sure your home is properly screened to keep mosquitoes out. By taking these simple but effective measures, you can significantly reduce your risk of chikungunya infection. Breaking the chain preventive measures for chikungunya. Preventing chikungunya requires a collective effort to eliminate mosquito breeding grounds and reduce mosquito populations. Remove any standing water sources around your home, such as flower pots, buckets, old tires, and clogged gutters. Change water in bird baths, pet bowls, and vases at least twice a week. Keep your surroundings clean and free of debris where mosquitoes can breed. Support community efforts to control mosquito populations, such as fogging or larvicide treatments. By breaking the chain of transmission, we can protect our communities from the threat of chikungunya. Staying safe in a changing world. A message of hope and vigilance. In an increasingly interconnected world, infectious diseases like chikungunya pose an ongoing challenge. While the threat is real, it is essential to remember that we are not powerless. By staying informed about chikungunya, recognizing its symptoms, and taking proactive steps to prevent mosquito bites, we can protect ourselves and our communities. Let us remain vigilant, embrace preventive measures, and work together to create a safer and healthier future for all.